Valerie.
Hey, Kendal.
I'm Kendal, and I'm going to be conducting a cardiovascular and pulmonary assessment, and I'm going to provide her with adequate privacy, wash my hands, all that good stuff. But, you know, as I'm talking to her, I'm just inspecting. I'm going to have you kind of pull your hair out of the way, sis. Inspecting her thoracic cage, making sure that it's symmetrical, not uneven, that her shoulder muscles are intact. You know, Carrie, kind of shrug up for me. Perfect. So I don't notice anything amiss. And I'm going to palpate for symmetrical expansion, tactile fremitus, masses, and tenderness, both anteriorly and posteriorly, and I'll be talking while I do it. So the first thing I'm going to do is go ahead and have you expand, just expand your chest, breathe normally for me. Okay. And I'm going to feel around for any kind of masses, tenderness. I'm going to feel underneath your breast tissue. Anything hurt at all?
Nope.
When you take a breath? No? Okay. And so we're going to do the same thing around back. We're going to feel for any masses, any tenderness in the long field. And then I'll show you via video whenever we have our turnaround about the expansion there. As far as the tactile fremitus, I'm going to have her say 99, and I'm going to put my hands on her different positions, like between the intercostal space, so I should feel a vibration from her speaking whenever I do this. So go ahead and say 99.
99.
And again.
99. 99. 99. 99.
Here.
99. 99.
Perfect. And I'm also going to do the breath sounds, which is the demonstration in the lung field while I auscultate. Since I've palpated, there's been no tenderness noted, to make sure that her lung sounds are equal. But also do a few tests that check for any kind of consolidation that would be in her lungs, or any adventitious lung sounds, which would both be negative things. So, Valerie, I'm going to listen, and then I'll have you say a few things, okay?
Okay.
So her lung sounds are clear and equal bilaterally, and it's important that we go bilaterally like a ladder so that we can hear those correctly. I'm going to have her do a whispered, it's called whispered pectoraliquy, right? Okay. And what I'm going to have her do is whisper 1, 2, 3. And I shouldn't be able to hear it at all. And if I do, obviously sound travels better through something solid rather than air. So if we could hear that, that would be a negative thing. But I'm going to have her do that, and then I'm going to have her use the vowel E. That should not sound like an A. And then also say 99, and I should just be able to hear something dull, kind of like a drum, but nothing. I should be able to hear clearly. So I'll have her do all 3 of those things. Okay? So, whisper 1, 2, 3. Each time do with the bell with my stethoscope. Perfect. And if I were looking directly at her lips, I could obviously see that she's saying it, but I can't hear anything, which is great. So again, we're going to do the bronchophony. So I want to hear you say 99, and I'm going to listen. So
99. 99. 99. 99. 99. 99. 99. 99.
Perfect. And once again, I should just hear sound. It shouldn't be really clear. If it is, then that would indicate some kind of consolidation or issue with the lung tissue itself. Okay, so I want you to say E each time I move my stethoscope again.
E, 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 E.
Okay, very nice. All right, so I'm going to go ahead and percuss her breath sounds, which just consists of me putting my non-dominant hand, pumping, all right, perfect. I'm going to have you turn around for me, sis, and I'm going to check your back.
Okay.
And we're going to basically do the same thing again, noting any tenderness, masses, good symmetry, noting the scapula so we know that her breath sound should be along here so that we don't get that sound of bone, which can be mistaken sometimes for other things. So I'm going to go ahead and have you expand for me. And you notice that my thumbs move apart as they should, so she's got equal air moving through both of her lungs, which is absolutely perfect. And I'm going to go ahead and do the tactile fremitus on the back, and she's going to say 99.
99.
Each time I move my hand.
99.
And again.
99. 99. 99. 99. 99. 99. 99. 99.
Perfect. And you should just feel that light vibration on your hand. So I'm going to also take breath sounds, and then we're going to do the whisper test again, and the other two. All right, sweetheart, take a breath for me. Thank you, Miss Valerie. Okay. Okay, so I want you to say 1, 2, 3 and whisper each time I move my stethoscope. Okay? Once again, I don't hear anything. If I were to see her lips moving, I would know she was speaking, but I can't hear that, which is perfect. So now I'm going to have her say 99 again, each time I move my stethoscope, and I should be able to hear something, but it should not be clear. All right, Miss Val. So 99.
99. 99. 99. 99. 99.
Beautiful. And again, I'm going to have her say a vowel, E, and it should just, there should be a sound. It shouldn't sound like it changes to an A. Beautiful. Okay, so we have checked for tenderness, found none, auscultated all breath sounds, looked at symmetry, looked at chest expansion, the expansion of her lungs and back, and all of those things are equal bilaterally, symmetrical, and clear. Beautiful. All right, Val, I'm going to have you turn back around so I can listen to your heart. We're going to talk about all people taking none. So we're going to listen to the aortic, pulmonic, tricuspid, and mitral, and we're going to count for a full minute, and we have a clock set up over there so that I can see that as well. So first I'm going to listen with the diaphragm and then the bell. So aortic, pulmonic, and the mitral's a little harder on women because the tricuspid's a little harder on women because it's kind of in the breast tissue. And then the mitral, and we're going to listen for rate and rhythm. She appears to have a normal sinus rhythm, just a normal rhythm, and I have a rate of 68. So we're going to palpate her carotid artery and listen to it with the bell and the diaphragm, and also listen to the valves with the bell as well. So I'm going to feel for the carotid artery. And it's strong and equal bilaterally. And then I'm going to auscultate, and we're checking for any kind of bruit with my diaphragm, and then with the bell. I'm going to turn around to the bell with my stethoscope. This is always fun. And the same here. Aorta, pulmonary, tricuspid. And it's a little harder to hear the mitral if you've got breast tissue. They're not completely naked. Okay. So her heart sounds appear to be regular. I don't hear any kind of irregularity or racing, anything like that. And her lungs sound clear, equal, and they are symmetrical. So thank you so much, Valerie, and thank you.